Okay, we're going in depth this afternoon on an important question. Do efforts to control mosquitoes cause more harm than benefit? Utah Physicians for a Healthy Environment released a report this morning, and we are going to be talking with the author of that report. But looking at some of what it says the Salt Lake City Mosquito Abatement District is causing that kind of harm by spraying pesticides from airplanes, trucks, and backpacks. Now, the spraying happens over areas near the wetlands around the Great Salt Lake. So it's on Salt Lake City's west side, North Salt Lake, and West Bountiful that are the areas of greatest concern. The report says pesticides have lost effectiveness to control mosquitoes, that West Nile virus is less of a threat than those pesticides themselves, and that pesticides hurt fetuses and infants more than others. And they say that new research even suggests pesticides may increase the risk of autism spectrum disorder and developmental delays. So joining us, the author of that study and founder of Utah Physicians for a Healthy Environment, Dr. Brian Moench. Dr. Moench, thank you for being with us. This report, I think I want to start with what I ended there, because it always causes me concern when I hear people talking about correlation with things like autism and developmental delays, because there have been so many problematic issues with that. So is that something that deserves to be in the report? Is there enough foundation for that?
Absolutely. People need to understand a lot more about autism than they do. The medical literature is pretty clear that about 2/3 of the risk of autism is related to environmental exposures, and the remaining third is related to genetic vulnerability. And that affects males a lot more than females. That's why about 4 to 5 times the number of autism victims are males compared to females. But so if we examine the medical literature on all the environmental exposures that are related to autism, at the very top of the list are 2 things that are a real problem in Utah. And one is pesticides and another is air pollution. We looked over 200 studies to compile this over 60-page report. And one of the most important of these studies was done in New York, where researchers specifically isolated 2 sets of communities and found that communities where aerial spraying of pesticides was allowed, they had an autism rate 37% higher than other communities where they actually allowed other types of pesticides, but not aerial spraying. So it wasn't really that good of a control group. The point being, that is the most closely associated setup to what Salt Lake City is experiencing.
And talking about this, I did want to bring up that we do have we did get a response to the study from the Salt Lake City Mosquito Abatement District. And I want to read you some of what they had to say. By the way, that SLC MAD, it's, I think, kind of an unfortunate acronym, like they're angry or something. So, but that's the acronym, that's what they use. So SLC MAD has historically utilized the latest science and information available to make informed decisions about mosquito surveillance and control measures. They continue to say all of these measures are within full compliance of regulatory laws and fully supported by federal agencies. Essentially, I read through this this response, and they really lean on the EPA and the CDC and say, hey, these regulations come in, they're strict, they have to get approval, and they're only using things that have been approved to be safe for humans. So why do you think that's wrong?
Well, they ignored everything in our report. When they try and defend in medical literature what they're doing, they are able to cite 6 reports that basically have nothing to do with human health, and especially the risk of pesticides. Our report has well over 200 reports that show unequivocally that pesticides are indeed neurotoxins at the low levels that people experience from this kind of spraying. And we should be reminded about the problems with EPA approval as being the basis upon which we accept things. The EPA has approved 85 different pesticides that have been banned in other countries. So they have long since ceased to be the kind of protector of public health that they should be. And this is just one of many examples. Government agencies for decades have allowed exposures that they never should have. And Utahns should be aware of that almost more than anyone else. With the decades of radioactive nuclear bomb testing in Nevada that drifted over to the state of Utah and caused untold harm, but was allowed by the government because they said it was safe. We're in a very...
Oh, forgive me, but we are just about out of time. I wanted to
Sure.
just ask one more thing, and if you could be succinct. But I do want to know what should we do to control mosquitoes? I mean, the reason they do it in these areas is because they can be a real problem, and the folks who live in those areas don't want to live with swarming mosquitoes.
But the spraying doesn't affect that. In fact, everything that we cited showed that spraying, in fact, makes it even worse. In fact, one of the studies showed that mosquitoes that breed in areas that are sprayed are resistant to 10 times the amount of pesticide as mosquitoes where there is no spraying. So they're not helping the situation. They're actually making it worse.
Okay. Well, hey, thank you so much, Dr. Brian Moench, founder of Utah Physicians for a Healthy Environment and author of this report. And we appreciate your time.
Thank you.